Hello, good morning, good afternoon, good evening. On behalf of SNV and partners, WaterAid, Practical Action, FS Work Bangladesh, and CEP University, I would like to invite you all for this workshop. In this workshop, we are going to talk about sanitation workers, who are the frontline workers providing the sanitation services. Next slide, please. So during the workshop, we would like to request you to provide your questions in the chat. And if you have any technical issues, you can also reach to our technical team so that they will support you. And I would also like to inform that the meeting is being recorded. Next, please. Next, please. Yeah, in this workshop, we will have presentation based on the city experiences from different countries. On from practical action on research on impact of COVID-19 on sanitation workers in Bangladesh. And after that presentation, we will go out for a breakout group where we would like to get the experience and also feedback from all the reflections from all the participants about the sanitation worker situation in your cities and contexts. After the breakout session, we have four case presentation. One is from Indonesia on standard operating procedure by Lena from Indonesia, SNV Indonesia, followed by National Advocacy on Sanitation Workers in Bangladesh. On behalf of Fecal Sludge Management Network in Bangladesh, Saidul Islam will be presenting about that. Then we will have presentation on experience from one of the municipality in Y municipality in India. This will be done by Asim from CEP University, Center for Water and Sanitation. And the final presentation by Kanika Singh regarding the global advocacy for health, safety, and dignity of sanitation workers. Next slide, please. When we talk about sanitation workers, depending upon the context, the definitions vary. But I mean, the moment any individual waste is outsourced, it becomes a sanitary. There are different streams like solid and liquid stream of the waste. But in our present, focusing more on the sanitation service chain, which is from toilet up to the reuse part. So at different nodes, whatever the workers are involved at the different nodes of the sanitation service chain are considered as sanitation workers. Next, please. In any service, there are a lot of dynamics. So in case of sanitation workers as well, they have this social and institutional dynamics in a sense like in the environment they operate. Like whenever sanitation worker has to perform work, there are customers. They put a lot of pressure for the sanitation workers on one side, that's more from the demand side. But on the other hand, the institutional dynamics is more related with the sanitation workers associated with the institution. I mean, we even see that most of the sanitations are informal workers, but somehow they are associated with some institution, and there are a lot of pressure from the employers and different working conditions as well. So on the institutional side, there are operating procedures, the quality of the equipments they use, and the capacity and the mindset of the workers as well. But when we look into this service recipient and the service provider part, there is this issue of payment modality as well. And we will look into these issues in detail later. Next, please.
And Rajiv has some small connection issues, so I'll just jump in for a moment until he starts moving again. Policy issues are, of course, multiple, and the advocacy is not just about though recognition is a first thing which is very important, but it's also then about labor conditions. Next one, please. Other issues are about safe worker conditions, understanding the different health and safety risks, considering also health insurance, protection in the workplace, and issues of equality. Next, please. I think Rajiv is back. Go ahead, Rajiv.
Yeah, thank you, Antoinette, and apology for this internet issue. For the sanitation services are one of the essential public services, but even these sanitation workers, they provide these very essential services. They still continue to work in very hazardous, and there are a lot of social stigma and the 4 issues what Antoinette just presented. Next slide, please. So the sanitation workers are facing a lot of issues, even though the services are very essential. And with COVID, the existing vulnerabilities have even been further deepened. So we did a study.
So we did a baseline study in 16 countries, and as part of that baseline study, we also collected information on occupational health and safety and the conditions of work of sanitation workers. And these are some of the highlights that drew our attention. So this baseline was in Bangladesh, Nepal, Indonesia, Tanzania, and Zambia. And 50% of workers were not formally recognized as service providers, which of course makes it very hard then to demand any compliance with standards. Only 26%, only a quarter, was following some kind of clear procedure of steps when they were emptying. Of the workers, only 15% had basic occupational health and safety training. Payment arrangements were all very clear. This was clearly the most important thing for workers, and I guess would make them quit if that wasn't arranged. Not saying that the payment was always sufficient, but that was an issue that was negotiated. And a third did not have any PPE, any suitable equipment. Next, please. So the issue of COVID-19, I think, did not fundamentally change the situation of sanitation workers, but it did make it more visible and make it more acute. So what you see is that there were some initiatives in terms of distribution of personal protective equipment. There was some stronger push to include personal protective equipment in contracts that, for example, given by the service provider or given by the utility to a service provider. And there was some more monitoring of use of personal protective equipment. I have to add, personal protective equipment is, of course, only one aspect of ensuring the full occupational health and safety. Next, please. I think it made us, maybe COVID made us more aware in many sectors of vulnerabilities and the need to be much better prepared. In some cases, you could argue that this is just the basics of being prepared, and we should have been prepared. But there's been work with governments to create a database of the different providers and think about what the incentives could be to professionalize the service, but also to give some kind of penalty to providers who do not comply. As Rajiv showed in the very beginning, this is not just the sanitation workers and their employers, or the sanitation workers, their employers and the municipality. It's also about the broader public awareness about health and safety and of the general public, and how customers deal with service providers. And I think there's really starting to get more attention and different initiatives to support sanitation workers. Next, please. So yeah, this event is a small contribution to all those efforts. We hope that you will have a clearer idea of the situation of sanitation workers, understand that it's important, that we need to look for a change in attitude towards sanitation workers. They are the people who make sure that we can live in a clean and healthy environment, and we need to value that. And we need to think about the structural measures that can be put in place in order to really make that work more dignified and increase accountability at all levels. Next one, please. Yes, so we'll leave you with this quote, and I believe we're now going to Uta.
Okay, so the topics of my about that the waste and sanitation frontliners in Bangladesh, what are the COVID impact and how we are responding, and how we are also planning and implementing the long-term recovery programs. So that I will briefly share. And I am Uttam Kumar Saha. I'm the practical action. Slide, please. Okay, so basically, you know that the practical action international development organization, and we have different development programs. One of the program is how we can make our cities fit for the poor people. So basically, poor people is a long-term vision for this, and particularly we are focusing on integrated and inclusive waste and sanitation services. And there is a clear focus that how we can transform the life of the informal workers and help them to established as a smart service provider, so they can be a integral part of the improved waste management systems. And we are helping cities in different countries to adopt a systemic and multi-stakeholders collaborative approach, so that they can work with multiple organizations, and particularly for the private sector, and to make, and particularly we are inviting the responsive behavior from the private sector around the waste management and sanitation businesses. Next slide, please. So the basically what we have said, one of the important element that how we can help the informal employer into the entrepreneurs. So we are working on a transformative approach. So that approach actually highlighting how we can help them to increase the access to technology, finance, and business development services by the sanitation and waste workers from different national departments and financial institute. We are also working with the Bangladesh Technical Education Board to develop competency-based skill development program for these informal workers, both sanitation and waste worker. We are also working with the Department of Inspection for Factories and Establishment. This is a department under the Ministry of Labor. Particularly, we are working how they can develop the labor standard for the Western sanitation services and the Western sanitation workers, and particularly how the Department of Labor can really include the occupation related with the fecal sludge emptying and solid waste collection in the list of hazardous job by the government of Bangladesh, so that these workers have access to labor welfare foundation fund by these workers. So that is the as the transformative approach we are working on. Next slide, please. So we launched a study in middle of the last year, 2020. You know that we are working with 3,000 sanitation and waste workers in 10 cities, and particularly with that 50 business cooperatives. These cooperatives are registered cooperatives. So in the middle of the last year, we launched a study to assess the immediate impact of the COVID to the workers, especially their job, their lives, and their overall uh, 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 as a overall their lives in their lives. So we interviewed 176 workers, among them 97 female and 79 male, and we adopted both the approaches. We interviewed 60% through the mobile and 40% we physically actually met. And we had well-structured questionnaire, and we also used the general health tools, which is and we did the random sampling. And so the next slide, please. So what we have found, the impact of the Western sanitation workers, I have just brought 3 slides from that report, but we have a long report on the whole report. If you are particularly interested, I can share the whole report with all of you. So what we have found that one person per every 3 households, they have lost their job due to pandemic. Because you know that, and what we have found that 41% household, and they reduced their income by 22%. And the more interestingly, because they have lost their job, also the other cleaning job in different commercial complexes and different institutions, so that were closed, so they are not allowed to go there. And losing jobs and income, and also income has impacted on their food habit and many other aspects. So what we found that 35.5% household actually could not manage 3 meals per day due to the pandemic. So that is the main findings we have found. Next slide, please. About the occupational health and safety scenarios, the findings, what we have found, that is from our town where we have been working since last 7-8 years. So these findings might not be representative of the other municipalities in Bangladesh where they do not have any development project. So what we have found that the 81% they have are in the average standard occupational health and safety protections, and among this 81%, it's 74% they use during their work. And and what we have found that if we talk about the PPE, that we have found that more than 51% of the West workers, they did not have any sufficient PPEs this is one of the issue that we have found. So next slide, please. And then what we try to understand their hygiene practice, especially during the COVID period. We try to understand that their frequency of the waste worker and hand washing material, what they use, and also the other factor, the practice of social distancing at the household, at their community level, actually. So what we have found, they have one kind of knowledge about the using of this soap, and many of them are actually using the soap, and they are using different material, both the sanitizer, mostly the soap and liquid soap and soapy water, but very few of them also using the sanitizer. And 56% actually they are aware and they are maintaining the social distancing. So what I have said earlier, that this is not the representative case for the whole Bangladesh. This is some of the town where actually we are working since last 7-8 years. Next slide, please. So the next question is that how we are actually responding this waste worker and sanitation worker. So we have taken a number of initiatives in our development program. We have already demonstrated the social security scheme for the waste and sanitation worker. So this security scheme is also including the insurance coverage of the sanitation worker. Especially, we have introduced the insurance systems, getting the benefit of the discounted health services, and they have also the coverage for casual fatalities. And we are also providing the PPE and hygiene kit support. It's not only the practical action, but also the municipality and other development workers. We have a multi-stakeholders coordination platform in each of the cities, so that each of the worker, they can get the whole support. So that is our main strategy for delivering this support kit. And we are also disseminating the COVID messages, although it is not in the face-to-face. It's a digital learning session we are organizing with the workers and their cooperatives. And very recently, we have started helping them for the registration and accessing the vaccines with the help of the local municipalities. And we have also demonstrated some of the hygiene station in different settlements of the waste and sanitation workers. And we are also supporting to provide some low-cost, small-scale, decentralized emptying technologies, so that they can use that during the emptying services, and they can also improve or upgrade equipment. So that type of support actually we are now providing. So in this way, actually, we are trying to responding, and we are also trying to help them in the long-term approach. So next slide, please. This is there are some photos. This is about the occupational health and safety support. This photo actually is from the before the COVID. And the next slide, please. And this is a photo that one of the, we have cases for more than 5 of the one cases where sanitation workers actually died, and they had the insurance coverage, and they got the insurance support from the company through the mayor of the that Faridpur municipality. So insurance support from the project from now the mayor gradually taking up to increase the scale and support the existing worker from the municipal budget. So that's the one of the advocacy work we are continuing with different municipalities. So that was in a very nutshell about my presentation. So thank you everyone for listening me. Yeah.
Oh, am I? Yes.
Oh,
thank you very much.
Yeah.
Thank you. Thank you very much, Uttam. I see a lot of appreciation here. Applause for your presentation, though virtual. I have to get used to that. I think there's no immediate questions, and we're also a little bit behind on the schedule. So I would like to propose that we go back to the group work. We have about 10 minutes now, 10 to 15 minutes for a group reflection, which is about the situation of sanitation workers in your context, and considering the situation before COVID and consider the situation during COVID right now. We would like you to go to the whiteboard during your group work, and there you can post some comments on that whiteboard, and we can then later on take a picture of the whiteboard, and at the end of the session we can bring all this information back into plenary. So we'll have group work of 15 minutes, but then we don't go into plenary right after that. We'll go into plenary at the end, after seeing all the presentations. There's a comment in the general chat. No, there's not. When Marty clicks on a button, there's no walking, any movement required from anybody. Marty puts us all back into our tables. And please try to find somebody who can take a bit of who can chair a bit and have your discussion for 15 minutes. I'll come back to you. Hi, welcome back everybody. I hope you enjoyed discussions with the whiteboard, and especially with your other participants in the groups. We now have 4 presentations coming up from different parts of the world. We're starting with Indonesia, then we'll have Bangladesh, then we'll have India, and then we'll have a global presentation from the Initiative for Sanitation Workers. So a bit of your patience, we may be running over a bit, but the content is really interesting, I promise you. So now over to Lena for the first presentation.
Hello everyone, thank you to the conference committee for being here. I'd like to present the standard operating procedure or SOPs that we developed for sanitation workers in our project in Indonesia. I will also discuss the challenge that they face during the pandemic and the opportunity that came with the new normal. Next, please. In Indonesia, our Waste SDGs program is focused in 3 areas, Bandar Lampung, Tasikmalaya, Metro. The population of Bandar Lampung is around 1.1 million, Tasikmalaya 800,000, and Metro 170,000 inhabitants, with Bandar Lampung being the most dense among all. Next, please. Before SOP, there is a common practice during emptying in Indonesia that burn newspaper scraps thrown into septic tanks to show clients that septic tank has completely been empty. This practice increases the possibility of accident due to gas build-up. This is the example of such accident. Next, please. Okay, it seems that the video...
Mobil penyedot tinja. Diduga gas yang ada di dalam pembuangan tinja perumahan Cakung itu yang menyebabkan kematian korban. Korban juga tewas dalam kondisi terluka karena kerasnya ledakan itu.
Okay, since that the video is not but this video shows septic tank explosion during emptying process in 2019 in East Jakarta. This situation worsened due to the lack of influences for emptiers. Next, please. Another common practice before SOP is that the majority of collected sludge does not reach designated areas. For example, here in the table, we can see that during our baseline in 2018 Metro, 17% of households did emptying services, but only 3% of sludge reaching the treatment plant. No monitoring mechanism in place, and some MTers were not even aware that they are not allowed to dump the sludge or rice field or do anything. Please. Case study of MTR in Bandar Lampung before SOP. Next, please. We review 1 out of 1 public MTR, 4 private MTRs. The total number of private MTRs were not known because mostly they're informal. But the one that we review here were the ones that already have MOU with the public MTR. Most of these private MTRs were already in operation since 2010. Next, please. In terms of resources, for example, the skilled worker or drivers or helpers, or the number of trucks, private have more resource compared to public one. Next, please. On the compliance on SOP for occupational health and safety policy, we found that no provider have SOP on OHS, and consequently, the SOP for OHS were not implemented. Next, please. We review 11 parameters on OHS. For the regular checks on vehicles and their recognizability, all OHS parameters remain weak. No providers are aware of accident-related protocols. Next, please. The main reason for not applying OSA, occupational health and safety, are lack of regulation, lack of supervision, feeling of discomfort in wearing protective during the work. Next, please. SOP in three. Next, please. SOP. We developed 2 types of SOP, technical such as operation and maintenance, and non-technical ones such as administration. The scope of SOP is from dislodging, collection, treatment, reuse, and or disposal of vehicle sludge, and climate change impact is also mainstream in the SOP. Next, please. Next, the scope of SOP. The backward, please. The SOP divided into 5 sections. The first one is safety, health, and hygiene, which contain SOP on relevant aspects, the checklist, and visual nudges. And the second one is the scope of work from driver to manager of treatment plant. And then the third one is operation. The fourth one is maintenance and troubleshooting. And then there is additional SOP. Next, please. Of the SOP development is started with a desk review, and then continue with gap analysis on comprehensiveness and availability and user-friendliness of existing SOP. Continue with stakeholder mapping, and then the development of key question and checklist. Next, please. And then the data collection. This is the example pictures of data collection process in Tasikmalaya, in which we interview MTRs, operators, admins, mostly were done by consultants under our supervision. Next, please. And then also the same process that we did in Bandar Lampung, where we interview MTRs, admin, and operators. Next, please. And then we wrote the SOP, tested the SOP, but the SOP testing took place through Zoom due to the travel restrictions due to the pandemic. This is the example of SOP testing in Tasikmalaya in July 2020. Next. And then we revised the SOP based on the feedback from users, and then rehabilitation, training, and continuous monitoring and evaluation. We found that the key success to SOP development is that the process should be participatory, gradually implemented, and continuously improved. Please. Results from implementation. Please. The most visible improvement of the SOP is on the treatment quality. So the SOP was developed and tested in July 2020. This is the result measurement, the monthly measurement of effluent quality. This one is total coliform per 100 milliliter in effluent, logarithmic scale. As you can see that the quality of effluent in terms of total coliform is improved. In fact, it has 100 times quality. But since the effluent quality could be measured because the lab was willing to do sampling for fear of coronavirus in untreated fecal sludge, the efficiency of coliform removal cannot be measured. Next, please. In terms of sanitation workers themselves, the focus of SOP was only on safety and health, in which some employers are more aware of safety and implement safe practices and have health insurance. We have not done other work yet. It will be coming in hopefully this year. Next, please. There are also some improvement in retrofitting that help the better practice. For example, the pipe for fecal sludge suction was modified at the tip based on the feedback from employers that sanitary napkins often clog the pipe. Next, please. Challenge and entry point. Next, please. Main challenges are and motivation of operators, budget for effluent quality testing or very minimum, stigma from community, especially during COVID-19 pandemic. Next, please. This is the sample of rejection letters from the community toward MTR due to fear of coronavirus in wastewater in Tasikmalaya last year. Next, please. We did, of course, investigation whether it was really related to coronavirus, and we did socialization to head of villages and local government partners through Zoom on the critical role of MTRs in maintaining public health, especially during pandemic. Next, please. Also show fecal is sanitized and is equipped with portable hand wash facilities. Next. There are also additional SOP. For example, when there is request from customer, we ask whether any condition at home. If yes, then we apply extra PPE for the MTRs. Otherwise, just usual PPE, please. Some entry points. Engage the MTRs and then schedule the sludging and change in payment collection system. We see that schedule the could increase compliance in making sure that the collected sludge will reach designated area or treatment plant, because for payment collection in the scheduled sludging is no longer directly from customer to driver, but from customer directly to admin. Payment to driver is given after confirmation from treatment plant operator. And then application of management of or MIS, it will increase the compliance on SOP as the transition now available to be monitored in the already developed MIS application. Next, please. This is engagement of private MTS academy.
Lena, can you wrap up, please?
Yeah, this is the last slide. The status of SOP now in terms of availability. Now all cities has SOP. They are all comprehensive and they are all user friendly and has different level of implementation in every city. Complete now. Thank you.
Thank you very much, Lena. It's a very comprehensive effort, and I think it would really merit a whole lot of further conversation. I would like to ask Saidul Islam, please, to come to the stage, and if you could load presentation 4, please, Marty. James is saying, James Wicken is writing in the Q&A whether anybody has noticed positive changes during the pandemic. For example, greater appreciation of the role played by sanitation workers and risks they take for community health. I think this is not a specific question to any presenter, but more in general and maybe also to everybody. So if you want to comment in the chat, please go ahead.
Okay, so welcome to the presentation of FSM Network Bangladesh. So I will share the advocacy at the national level by the FSM Network, particularly to promote rights and dignity of the sanitation workers in Bangladesh. Next, please. So the FSM Network, we established the network in 2016 as a advocacy and knowledge platform in order to ensure and promote the rights and dignity of the MPRs, particularly to promote the FSM as a whole in Bangladesh. And currently we have 80 members from government, local government, development partners, NGOs, and private sector. So the FSM network to promote the FSM, so it organizes a national convention in each year at the national level. And side by side also, it organizes the PIT MTR's convention to promote the dignity and the rights established. So every year, so the PIT MTRs come to Dhaka, and we arrange meeting between in the conference. We arrange meeting between the national policymakers and stakeholders so that they can share their views, etc., and the issues are there. So in order to cross-building and also to know to create awareness among the policymakers. Next, please. So far, the network, we did 4 conventions. The first one in 2016, and particularly on recent work. There we promote the dignity for the PIT MTRs. And the second one mainly to promote the occupational health and safety. And in 2018 on MTRs, because we like to see the MTRs as an entrepreneur. And there are cases also in Bangladesh. So they become entrepreneur. So as Uttam also mentioned just recently, so we are also promoting the health insurance for the MTRs, because the current health packages do not cover the PIT MTRs or the waste workers in their package. So we come up with some different health insurance packages so that they can get access, get the benefits of this health insurance. Next, please. So as a result of these initiatives, so the government in 2017 issued a circular directing all the city corporation and municipalities to ensure occupational health and safety, to provide them training, to ensure the PPEs, etc. And also from the central government also developed some, come up with national training manuals or training modules for the PIT MTRs or the waste workers for this on OSS. And also they government allocated fund from their own revenues to provide the training across the country. And also from the national government and DPAC and IT and BUET, they also started develop the core trainers team on OSS, and also at the local level there are trainers team as well. Next, please. So yeah, due to COVID-19, like other provisions, so it has an impact on these waste workers. So severely it impacted on waste workers, and the members of this FSM network did some studies to see the level of impacts, and did a webinar in last year to create awareness and sensitize the government so that government should come forward to reduce their bad impacts. Next, please. So these are the studies. So already Uttam shared there's an impact on this the livelihoods, etc. And the big challenge is that the study identified that there is a lack of knowledge. So lack of knowledge regarding COVID prevention and also awareness, and also the treatment facilities, and also the about their other issue, hand washing practices and others, and they do not get access to the health. Because they do not get access to the health washing facilities at the workplace. So it also had impact on the COVID. There are high potentials of risk of potential risk of COVID contamination. And also in the healthcare facilities, so we know that where the COVID patients and their caregivers are also visiting, and so we've identified that there's a huge lack of hand washing stations in the healthcare facilities. So the people are getting high risk of contamination. Next, please. So this webinar and others, so there's a huge media coverage on this situation of the waste workers due to COVID, and it also attracted attention of the policymakers, and they also took some practical initiatives. Next, please. So, so government in order to combat the COVID-19, so government took initiative to vaccination across the country. So, as a first initiative, government in 2028 October, so Ministry of Health, who is assigned for this, took initiative to identify, prepare a plan for vaccination, and their plan includes that there should be the frontliners should get the first vaccination as a priority list. So the FSM network took initiative so that the waste workers are enlisted into this frontliners list so that they can get the vaccine at the first step. And from the FSM network, so we wrote 2 letters, one to the Ministry of Health and the other one to the Ministry of Local Government to address these issues. And also in the local different meetings like LCG meetings, also we approached to the ministry so that they can also take some initiative so that the frontliners would get in the front in the vaccine, the waste workers get included in the vaccination list. Next, please. So also side by side, also the approach to the Prime Minister for these waste workers to address the issues of waste workers and for this vaccination so that they can include in the vaccination list. So the FSM network published the appeal in the major national dailies to attract the attention of the Prime Minister and also the other actors so that these groups are included in the vaccination list. And also they get PPEs and other support the government will allocate for them. Next. So as a result, so the Ministry of Local Government, Rural Development and Cooperatives, they issued 2 letters. One to the Ministry of Health requesting to include these waste workers into the frontliners list, and the other one issued to all city corporations and municipalities to include all these waste workers into the list for vaccination. Next, please. So as a result, in December, government when the government approved the vaccination plan, so they included these waste workers, both sanitation and waste workers in the list. They have targeted 150,000 waste workers in the first list, in the first priority list, so that they can get these vaccination services at first priority. Next. And in the registration form, online registration form, now we can see that there's a separate subcategory they have opened for these waste workers. So now the in this subcategory, the waste workers and sanitation workers, they can register themselves online. And also, so FSM network also developed some easy leaflets materials so that the MTRs, waste sanitation workers and waste workers can easily get them registered. Next, please. And also supporting the other actors, so the waste workers and local governments for registration process. And by now, so more than 26,000 waste workers got registration, and up till yesterday, so 20,000 of the waste workers got vaccinated, first dose. The second dose already 5,000. And the challenge that we are foresee for this thing, because the PTMTRs and sanitation workers, many of them do not have NID and the cell phone numbers. So these 2 things are mandatory for getting registered. And also there is an issue for SMS, so they could understand sometimes they say SMS and they are missed. And the other issue is as a challenge regarding that there are a huge number of informal PTMTRs. So to get them enlisted and making in the system, so it is another challenge. They are still excluded. So through this, this is one of the example of this FSM networks. So for advocacy initiative, so they ensure that the waste workers and sanitation workers get vaccinated. So and side by side also local government division and government from government side, they are providing training and distributing PPEs. So that also linked to this COVID-19 prevention mechanism program. Okay, thank you all. Next, please. Okay, thank you all. So now over to Antoinette.
Thank you very much, Said. Yes, that is a very comprehensive effort. And also showing how much you need to know the context to really come to the right connections. I would like now to invite Asim Mansouri from SEPT.
So, hello everyone. I'm Asim Mansouri and I represent the organization Center for Water and Sanitation at SEPT University. We are based out of Ahmedabad. And today I'm going to make a presentation on improving safety of sanitation workers in Y Municipal Council. And I'm making this presentation on behalf of them. Unfortunately, because of the COVID situation, they could not join. So I'll be making this presentation. So just to give you, can you go to the next slide, please? Just to give you a brief context about Y, that this city of Y is located in Maharashtra on the western side of India, as you can see on the map. And it's a small and medium town, but which is representative of around 4,000 towns of India, which are almost of similar sizes, of around 43,000 population. And this town is a very famous old holy pilgrimage town, because there are 250 temples and ghats here, but it is also famous for Bollywood shooting locations. So many of the Bollywood movies have been shot here. Can you go to next, please? So Y is one of the 8 global cities that was included under the citywide inclusive sanitation program of the Bill and Melinda Gates Foundation. As you can see, the other cities, there are 4 cities from India, 1 from Bangladesh, and 3 from Africa. Next, please. So before moving on to the work, just need to highlight that this is one of the first, Y is one of the first city in India to implement a citywide scheduled desludging program. And we are very happy to know about what Indonesia also presented, but here it's a little different. But this is one of the first cities and it has been declared ODF++. So as per Government of India's protocol, if nobody is found defecating in the open and all your wastewater, the fecal sludge and septage is managed, then you are declared ODF++. So this city got that recognition in 2018. Some key highlights of scheduled desludging that has happened in this city is that they have involved private sector, levied sanitation tax to finance these operations. They have set up an FSTP through philanthropic funds, and they have set up an online real monitoring system for monitoring the emptying and the treatment part. And the reuse wastewater is being treated. And last but not the least, and very important, that we have got a municipal council commitment and leadership for this activity. And it's a great ownership that we have got from them, and the operations have continued. Next, please. So before going into sanitation work, I think we need to also understand the institutional structure of that city. So Y Municipal Council is governed by chief officer, who is the administrative head, under whom there is a department called sanitation department, which has an engineer and a sanitation inspector. Under the inspector, there are sanitation supervisors and sanitation workers that are ULB employed. At the similar time, there are also private operators that are engaged by the council, the local government, for providing various services like the desludging operations, FSTP operations, CTPT, and labor contracts. So in the whole, Y Municipal Council manages around 95 sanitation workers. Next, please. And they're employed in various activities of sanitation like CTPT cleaning, solid waste management, door-to-door collection, roads and drain cleaning, and other activities that are related to sanitation. Next, please. So just before the pandemic hit, WMC along with CWAS undertook a study for improving the safety of the sanitation workers. For this, we studied these 8 aspects, which were 6 aspects, which was about profiling the sanitation workers, that we are trying to understand exactly what kind of work they're involved in, what is their employment type of structure, what is the contract type that they are having, Are there any employment benefits? The second thing that we assessed was the contract part, what Antoinette mentioned in her presentation, that we need to understand whether contracts cover the safety of sand workers. We reviewed, the third aspect was about reviewing the guidelines that were available for various sanitation activities and what type of PPEs were asked for in that guidelines and whether the council is providing or the private sector is providing that. Fourth, we also engaged with the sanitation workers. So we talked with them. This were more like qualitative discussions to understand what were the challenges that they were facing and what was the replacement and monitoring regime for these PPEs. Were there any processes followed or not? That was on the demand side. Similarly, on the supply side, we talked with many PPE wholesalers, the personal protective equipment wholesalers, to talk with them about user-friendly PPEs and compare their cost and whether they are available in market and what cost they are. And last but not the least, we try to understand the monitoring and replacement regime, because as we hear that generally PPEs are given one time and then forgotten. But as I think COVID has highlighted, that PPEs need to be, and especially for the sanitation workers, this PPE needs to be regularly replaced and monitored as well about their usage. Next, please. So based on this studies, some of the key findings I think were that contracts did not include at that time any PPE related clauses. All the contracts were did not take into account the safety of sand workers. Work specific and user friendly PPEs were not being provided according to the type of work that has to be done. And also there was no adequate replacement. Systematic monitoring was absent, and training and awareness for PPs amongst the users was also very low. So this was some of the key findings of that study that we did with the council. Next, please. To mitigate these challenges, the council took up these following actions, and they are already implemented in the council. So on the first one, to ensure adequate availability of appropriate PPs, the council took up two-pronged approach. First of all, in all their sanitation related contracts, they added clauses for the PPE related stuff. So for example, they added clauses regarding provision of adequate quantity with respect to the kind of work that the sanitation workers going to be engaged with. Second was on PPE usage, and penalty for non-compliance was added. And they have also set up in the as a part of the billing process that when the bill of the contractor comes, a monitoring and reporting report has to be submitted about the PPE usage and replacement to the council for clearing the bill payment for that month. Similarly, that was on the private sector side. If we talk of the second pronged approach, which was on the local government side, what the council did that they reviewed their PPE procurement tender and they added this list of mandatory PPE sets that were required as per activity. It's a small image right now, but this image is here that what type of PPEs are required for various activities. They revised their tender notice and now they are procuring the new PPEs as per the work and as per the quantity that is required, keeping replacement in mind. Next, please. To ensure that to improve the monitoring and replacement of the PPEs, along with the council, we developed this, as you see on the left-hand side of the image, monitoring PPE monitoring report record book, where the supervisor, the sanitation supervisor who manages all these 95 workers, does a proper recording. You can see in the bottom left corner a format in English, which records the name of the person, type of activity that they undertook, and the type of PPE that they're using. Similarly, we also developed some digitized system that you see on the right hand side on the top, the Sanitab and Sanitrack system, which monitors the PPE usage of the FSS and desludging service providers. And on the bottom right corner, you also see the replacement register, which now records the number of replacements that are done at what frequency and what was the reason. So each worker, we are now able to monitor the PPE replacement part of it. And one important point, I think what we want to highlight, that we did not create new registers for them. We adapted the existing formats that they had. So it's not an additional burden on them, but revising their existing formats, we asked them to just add one or two aspects so that the PPE recording and usage is monitored. Next, please. On about generating the awareness about the PPEs. By the council, PPEs were being procured and distributed, as you can see on the left-hand side photo. Before the pandemic hit, we were able to do a training and orientation workshop on safety of sanitation at workplace, which has actually helped during the COVID times, and people are using PPEs properly. we developed this resource materials for various sanitation workers about type of PPEs that need to wear. And this was stuck up at various places within the council office and at their workplaces so that they could see this and adapt and learn from this as well. And also, I think with this COVID and before the COVID also, the health camp and counseling sessions were organized for the sanitation workers. And now with this pandemic, this type of health camps and counseling are being regularly taken up by Y Municipal Council. Next, please. So it's so based on the learnings of this Y experience, we didn't stop there. We work at scale in Maharashtra. We are supporting the state government for citywide FSSM services. So under that support, we now developed a CSR proposal for PPE procurement for all the sanitation workers in Maharashtra that are spread over 366 cities. And if this proposal goes through and we are able to mobilize CSR funding, it will impact around 27,000 sanitation workers of Maharashtra. Next, please. And it will include all the aspects that I talked about before, about getting clauses added in the contracts, training and health camps, etc. It's not only about PPs, but what Antonio mentioned is that going beyond PPs and streamlining other operations as well. Now, I think we need to also acknowledge that all this work could not have happened without partnerships and collaboration. And we are thankful to our funders, the Gates Foundation and DFID, and especially to our local government partners, the Y Municipal Council, Government of Maharashtra, and the Sinnar Council, where also we have been working on similar aspects. And also talking about the National Fecal Sludge Alliance, which has scaled up the learnings from these cities at national level as well. Next, please. Okay, yeah. So I think just to conclude, and if you want to read more about our work, go on our website, pass.org.in. It's mentioned below. And just to conclude, I think to recognize the efforts that our sanitation frontline workers are doing right now and what they're doing before as well, but we have now lately started to realize them as more important. Please, I would request the Marty to just play that video that we created to salute our frontline sanitation workers along with the council. Sorry, Marty, if you can just go on that video link.
And somebody asked whether the presentations will be available. I've just been told by Rajiv that the presentations will all be uploaded on the website. Just another fun fact is that one of the reasons why Rajiv's connection is so bad is because he's in quarantine in a hotel. So every single thing is really affected by COVID. I hope you will not be leaving, though we're somewhat over time, because we have one last very interesting presentation from the Initiative of Sanitation Workers by Kanika Singh. So Marty, could you please bring Kanika up to the stage and also her presentation?
Hello everyone, I'm Kanika from WaterAid, and I would like to share some updates about our global advocacy project, which we are implementing as a joint partnership by the Initiative for Sanitation Workers. Next, please. So just to give a brief background, in 2019, the World Bank, WHO, ILO, and WaterAid jointly undertook an assessment on the health, safety, and dignity of sanitation workers. And this involved various documentation of case studies across different countries, and also some desk review. And it gave us a good understanding of the different kinds of challenges faced by sanitation workers, be it around health and safety, dignity, financial insecurity, the stigma and discrimination they face, etc. And it also helped us in identification of various good practices which were being implemented in different parts of the world. And based on these, we were able to come up with some areas for action for future advocacy on these issues, which included policy and regulatory reforms, development of SOPs and guidelines, and building evidence base, and also advocacy for sanitation workers and their empowerment. Next, please. So building on the learnings from this assessment, in 2020, a global advocacy project has been initiated by a group of organizations working together. These include the World Bank, WHO, ILO, SNV, and WaterAid, and with some additional support from BMGF. The three major outcomes of the project are, one of these is the political prioritization. So we are aiming at including sanitation workers' rights in the political agendas of government and civil society actors at various levels. The second outcome is to influence the wash and labor sectors and to mainstream the issue of sanitation workers in various initiatives and projects being implemented by wash sector and labor sector organizations. And the third key outcome is to address the knowledge gaps around sanitation workers issues through various research initiatives and knowledge products, which we expect that it will help in supporting the political prioritization of this issue and also inform various policy and programmatic initiatives. Next, please. This table here gives a brief overview of the 14 different activities we are implementing under these three.
Rajiv, could you write? Oh,
Here we
she's
go.
there.
Oh, okay.
Good, we have you twice. Yeah, go ahead.
I'm sorry, there was a power outage here. So anyway, so this is the overview of our project activities, and I'll be speaking about some selected initiatives out of these. So the next slide, please. So starting with the work on networking support. Under this activity, we aim to support sanitation workers organizations and organizations working with workers in their initiatives for mobilizing sanitation workers and also in engaging with the local authorities. So we are considering a number of ways to do this, which include creating spaces for sanitation workers and their representatives to engage with authorities and have their voices heard, and also providing micro grant support to some of these organizations and networks, which would help strengthen their initiatives. Next, please. This activity is part of the outcome on mainstreaming sanitation workers' rights under wash and labor sectors. So what we're trying to do is to integrate some initiatives for supporting sanitation workers in the program design of at least 3 urban sanitation projects being implemented by the World Bank. And currently we are considering 3 countries, Ethiopia, Bangladesh, and Nigeria for this initiative. Next, please. So we also have an initiative to support the engagement with informal sanitation workers. So all of us here would agree that within the larger umbrella of sanitation workers, the ones who are engaged informally are even more vulnerable and they face higher challenges. So we are trying to reach out to various employers and workers organizations to explore different ways in which we can engage more systematically with these informal sanitation workers and also see how we can represent them more at various spaces. Next, please. Now some of these activities fall under the outcome of addressing knowledge gaps. So here we have an initiative to develop a research agenda which would highlight various issues around sanitation workers which need more research and more attention. And once we draft this, we will be doing a virtual consultation with sector experts and also sanitation workers representatives. And upon finalization, we will be publishing this in a journal and also WHO publication websites. Next, please. Complementing the previous activity on research agenda, we also have some initiatives aimed at incentivizing research on the sanitation workers issues, and also exploring ways on how we can involve the workers themselves in these research studies as well. So currently we are considering different ways such as supporting doctoral and master students and providing seed funding for research proposal development, and also grants for small discrete studies. And as part of this initiative, last week we had announced a research award on sanitation workers in collaboration with the University of North Carolina. So basically this award is linked to the 2021 UNC Water and Health Conference. If you haven't seen the announcement yet, I'll share the link of this in the chat box. So that's a very exciting opportunity for submitting research papers and abstracts on sanitation workers. Next, please. Now, coming to this activity, so we will be collecting various existing SOPs, guidelines and regulations which are being implemented in different parts of the world, and we will consolidate these in the form of best practices and checklists, which will be relevant and helpful for various actors in their work, such as governments, development partners, donors, and sanitation workers organizations, etc. Next, please. Similar to the previous activity, we will also undertake a review of the existing and emerging technological innovations which focus on improving the health and safety of sanitation workers. And based on these, the good practices and the technical specifications will be disseminated widely. Next, please. And under this activity, we will also be reviewing various existing checklists and tools being successfully used for data collection on sanitation workers in different parts of the world. And based on these, we will develop a standard checklist or a tool which can be used by other organizations. And we are also trying to have some questions on sanitation workers included in this year's GLASS exercise. Next, please. This is the last activity which I'll be sharing about. So this would involve a systematic review of the existing evidence on the health and safety of sanitation workers. And we will also be attempting to estimate the workforce numbers and the burden of disease faced by sanitation workers. So we expect that this whole exercise will give us an idea of the different types of risks and the different scale of risks faced by sanitation workers, and also its relation with the gender and other intersectionalities. Next, please. Yeah. Thank you so much for listening to this presentation. In case there are any more questions, I can take those up in the chat. Thank you. Over to Anthony.
Thank you very much, Kanika. And it's a real big variety of work, and it's a very interesting effort, I think. It's only just starting this year, but I'm really curious to see what will come out. So there's a couple of things that went a bit wrong. We are completely over time. I understand that I have received one group their feedback on the reflection. So, and I don't see many questions in the Q&A. There's one question just added. Asim saying there's greater appreciation and recognition now of the work done by sanitation workers. To close, I just would like each group to send one person to the plenary to give some reflections. So there were 3 groups. Maybe I can ask maybe I can ask Gabriela, Rajiv, and Asim. I think you were in 3 different groups to have some closing reflections. Is that possible? Oh, in the chat. Okay, and notice please in the chat that there's the research announcement of the Initiative of Sanitation Workers. Marty, could you bring Gabrielle Helcrow, Rajiv Munakami, and Asim Mansouri back into the plenary, please? So who wants to start? Can you give a few reflections on the session? Gabriella, do you want to start?
Sure, very happy to. Thank you. Within our group, we were lucky enough that we had several of the presenters. So I think we've just seen some of the ideas. There were quite mixed response. Some was around, it was as we expected, but there were also examples, I think it was from Asim, one around seeing that it had actually, there was greater recognition during COVID, particularly of the contributions that sanitation workers made. We also had a discussion around trying to understand what was happening in the Pacific, and that a reflection that there was really no evidence or data that we knew of to share that, but a discussion around, for example, some of the smaller countries that have very small entrepreneurial businesses, that is really a topic to be discussed further. Good.
Now I'm deducting here that you were in the same group as Asim. That's not very good. Asim, do you want to comment something?
No, I think just to add what Gabrielle said, I think she has covered most of the points. But we were hearing, I was not there in the full session, but we were hearing views from Cambodia as well, that now, and also from other places, I think Indonesia was one, where now sanitation workers are being recognized more, and the work has now been dignified. Let me put it that way. That, to summarize, I think first it was a meaner job, but now it's, because post-COVID and during COVID, I think this work has been more dignified. Yeah.
Good. I notice Rajiv is not coming back. Is there anybody else from the group here, from the plenary, who wants to make some closing remarks or share what has been discussed in their group?
Antoinette, they can raise their hand if they want to. There's a little button at the very bottom, raise your hand, and we can read.
You can raise your hand or write your name in the chat. We also got some input from Manima, who managed to send the input from her group. And she said that before COVID, sanitation workers were not using any PPE, but after COVID, they weren't either. But that the government is now focusing more on frontline workers of of corona. So looking at the army, at the border, looking at nurses, but not so much at sanitation workers. Another bit that she talked about is that before COVID, sanitation workers were not taken seriously, and after COVID, this has not changed very much because households don't have a lot of information about this. So I think the conclusion is that there is some progress, but there's still a lot of work to do, right? And on that, I think we need to close here. So I want to thank everybody, all the presenters very much. Also thank Rajiv, especially for setting up this whole session, working with all the presenters. I hope he can hear us at least, and that he will be out of quarantine soon. And I hope you enjoyed this virtual conference. Thank you.
Thanks, everyone.